Hello everyone. Today, we're going to be discussing a question from Typical PT's platform. Let's jump right in. Here is the question. In which one of the following scenarios is a patient at risk of losing their eyesight? Here are your answer choices. A. A 60-year-old diabetic female with a burning vesicular rash in the C6 dermatome. B. A 6-year-old male with pus-filled vesicles around the mouth. C. A 20-year-old female with red, raised, disc-shaped plaques that worsen with sun exposure. D. A 54-year-old male with red, edematous skin in the lower limb with fever. Go ahead and pause the video, think through the options, and decide which patient is most at risk of losing their eyesight. Welcome back. The correct answer is choice A. A 60-year-old diabetic female with a burning vesicular rash in the C6 dermatome. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Now let's use the diagram to explain why this answer is correct. Answer choice A is correct because this scenario describes an infection with the herpes zoster virus that can cause shingles. This condition presents with a painful vesicular rash that follows a specific dermatome. It is more common in diabetic patients. According to the rationale, involvement of cranial nerve 5 can lead to vision loss. This is why this patient is at risk of losing eyesight. And on the diagram, we can see the comparison between HSV type 1 and HSV type 2. HSV type 1 primarily causes oral herpes, also known as cold sores. It spreads through oral contact, such as kissing or sharing utensils. Symptoms include cold sores around the mouth, sometimes with fever and blisters, and these occur above the waist. HSV type 2 primarily causes genital herpes. It spreads through sexual contact and presents as painful blisters or sores in the genital area, below the waist. This diagram helps distinguish between types of herpes infections based on location, mode of transmission, and symptoms. Now, let's go over why the other choices are incorrect. Choice B is incorrect because it describes impetigo. Impetigo is a superficial skin infection caused by Staphylococcus or Streptococcus. While it is highly contagious, it does not affect the cranial nerves, and therefore does not cause vision loss. Choice C is incorrect because it describes discoid lupus. This condition is confined to the skin and does not affect the visual system. Choice D is incorrect because it describes cellulitis. Cellulitis can be life-threatening and can cause systemic effects, but it does not specifically cause vision loss. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing skin-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.